Next, pleased to welcome Sarah McDonald and Lance Charles here with us in the room. You have 5 minutes for your opening statement. I understand that you're going to be sharing the 5 minutes, if I'm not mistaken. So you have the floor. Welcome.
Thank you. Thank you for having us. My name is Lance Charles. This is my wife, Sarah McDonald. She's the mother of Brianna McDonald. Brianna passed away on August 23rd from an overdose. She struggled with mental health, and it dragged her down pretty to a dark path. She was an amazing little girl. She had a laugh like no other child. She was there for you when you needed her. And around the time when I came into Brianna's life, Brianna started to experience issues with her mental health. She started experimenting with drugs as well. Her drug of choice was Molly, but would try anything she could get her hands on. Brianna had over 20 recorded suicide attempts. She tried to overdose on prescription drugs that she would steal. Over time, you could see she was going down a very dark path. We as parents started to discuss what we could do and try and get her help. We looked into treatment centers, mental health centers, doctors and counselors. None of it helped. The treatment centers would tell us that she was too young. The doctors would tell us she had behavioral issues. Others would tell us she's too young to diagnose. Brianna's father and I would beg doctors to keep her in hospitals. The doctors would overlook what we said and release her, sending us home with Narcan kits. This was really starting to get alarming. We spent every other week with Brianna at the hospital, it seemed like. She was prescribed many different medications and prescriptions. Some worked for a bit, others didn't work at all. We noticed things were getting darker. She became a ball of rage. She was up all night, sneaking around and doing her drugs. She started to come and go as she pleased. Sarah and I would often get woken up by the police, bringing her home because she was found extremely intoxicated. Police would also be needed when she would have her violent episodes and threaten to kill herself. An officer actually asked me once, what would I like him to do? I told the officer, she's threatening to harm herself. Please invoke the Mental Health Act and force her into a hospital. The officer told me he couldn't because that's against her will. This is when I discovered the Infants Act. This little girl had more rights to her medical decisions than her own parents. She could tell doctors anything they wanted to hear, and they would release her. Back in February of this year, Brianna was found in the kitchen overdosing. Sarah called 911, and an ambulance came a short time later to take her to Abbotsford General. Sarah got very mad when she was at the hospital. She stood up to the doctors who were just going to pump Brianna's stomach and send her on home. Sarah directly told the doctors, we are tired of this. And Brianna needed help with her mental health. This time they sent her to Children's Hospital in Vancouver. Brianna didn't do well there. She was lashing out at staff, screaming. They really couldn't handle her. They weren't fit to handle her. So they transferred her to a place called Cap Soo. It's at Surrey Memorial. They held her for about 10 days. While there, she did have her good days and she had her bad. Sarah had a meeting with the doctors. They told her Brianna was clear to be released, when realistically she wasn't. She had just finished putting a pencil through her hand. Well, they have been... Once again, Sarah fought to keep her there, and of course, all they did was send us home with a Narcan kit. This is when we started to see the real dark side of Brianna. We noticed she started using drugs like Molly on a regular basis. We were astounded that she could actually get these drugs. One evening, a car randomly pulled up in front of our house. I went outside after asking my wife who this person was showing up in front of our house. Turns out We didn't have a clue. We went out to look, or I went out to check and make sure and ask what this person's business was in front of our place. These were two 16-year-old children there to sell our daughter, Molly. So we took pictures of the license plates and reported it to the police. The police never did anything, didn't even report back to us. Now I was really getting worried. It was shortly after Sarah started wondering what else was she up to. So she started following Brianna around. Brianna would actually go to a harm reduction site, and she would acquire these Ziploc bags full of needles, cooking kits, and pamphlets on how to cook the drugs and safely use them. We were astounded the fact that these were available to a child. How can a 12-year-old at that time acquire these? She can't buy marijuana at a dispensary. She can't buy booze at a liquor store. But she's able to pick up these kits to use drugs from a harm reduction site, a site that is meant for people that are not children. It didn't make any sense. Now we have reached the darkest times just before she passed. Around the end of July 2024, Brianna became so violent towards her mom and I. And this was a direct result of not just the drugs, but her mental health had gone so far down a deep path. Sarah was destroyed seeing her daughter do this. We talked about it every night, trying to figure out what to do. Days later, Brianna became so violent with her mom and I. She got into a fight with her mom and actually caused some serious damage. Her mother ended up in hospital with a severe concussion and some serious brain trauma. I ended up with a black eye and a cracked orbital socket. Now her mental health was really in a dark spot because now we didn't feel safe with having her at our house when we have other children. So the police removed her from our house and advised that it was not safe for her to be around our other children because now she had become so violent. So they ended up taking her to a place called Cyrus House. And Cyrus House tried to hold her and keep her there. She stayed one night. The next night she didn't return. So Cyrus Center, when she didn't return, put out a missing persons report. This is when we found out she now wanted to be at a homeless camp. The police found her there. They didn't directly tell us that she was at a homeless camp. We found that out days later by ourselves. All they said to us was, she is safe, and she's with another adult who's nobody to us. We didn't know her, didn't even know her name. Since when is it okay for a 13-year-old to be at a homeless camp? Why didn't the police bring her back to Cyrus House? Why was she just left there with another adult that doesn't associate with us? We did keep in contact with Brianna every day. We brought her food, we bought her clothes, but she didn't want to return home. We tried to inflict rules, try to give her more stability and tell her that if she comes home, she's got to follow these. And she goes, why? I can do whatever I want out here. It didn't make any sense. You know, if she needed clothes, she needed anything, she could always reach out to us, and we were there for her. Now we come up to August 22nd, 2024, and August 23rd, 2024. I went to work on August 22nd thinking this wasn't going to be a change in my life. I was at work, and I worked night shifts at C-SPAN International. And my wife, who never calls me at 3 in the morning, I received the phone call, the one that a parent dreads. She started the conversation off with, I love you very much. this is when she proceeded to tell me that our daughter had passed. This is every parent's nightmare. This is when we realized the system we have in place has failed her, and massively. The people she could go to for help failed her. My question, and always will be, is why are harm reduction places considered safe? Why our children aren't allowed, or not, I shouldn't say allowed, why is there no programs really in place for our children and their mental health? These drug addictions would have never become what they were if she could honestly get the mental help. She used to tell us she would have demons and voices in her head, and the only way she could drown them out was through the drug use. If I don't know about you guys here, but when you stand back and think about that, that is very alarming. That a child is using drugs to drown out voices in her head. The mental health problems were there, but anybody we reached out to weren't. They would send us home with Narcan kits. They would tell us that we can't force her into anything against her will. On September 19th, Brianna's friend, Shayton, very, very lovely little boy. They were best friends. They started experimenting with drugs because they both struggled with mental health. He had a very hard time dealing with the fact that Brianna was gone, to the point where he made a suicide attempt shortly before Brianna's funeral. And days later, after her funeral, succeeded. He is no longer with us. These are two 13-year-olds, two of them, that have passed. Now, not only because of drugs, but struggling with mental health. We need things to change, because our children are dying, and we can't afford to lose any more children. I thank you for bringing us here to speak, and I hope Brianna's story, and as well as Shayton's story, can bring awareness to the struggles that our children are having, and to bring awareness to the parents that are struggling with children that are struggling. It hurts every day thinking about this situation, because I think if Brianna had access to the proper mental help, she'd still be here today and be able to tell you this herself. Instead, we have to speak on her behalf because she's no longer with us. It breaks my heart having to speak about a child that's no longer here. We do need change, and it needs to be now. Our children are dying, and no other parents should be going through this pain. And I hope today we can bring some answers and enlightenment to this subject. I thank you.
Thank you, Mr. Charles, and please accept my condolences and those of my colleagues on the passing of your dear Brianna, and also our respect for your courage to tell such a personal story in a public forum. We are now going to begin with rounds of questions, starting with the Conservatives. Mr. Doherty, for 6 minutes, please.
Thank you, Mr. Chair. And if I can start off by saying, Mr. Chair, thank you for allowing our witnesses the time that they deserve to tell their story. I'm going to focus my my questions on Mr. Charles and Ms. McDonald. I want to thank you guys for your strength. And I don't know if I would have had the same strength that you have. And so I thank you for that. If you could send one message to Justin Trudeau about the failed drug policies, what would it be?
How can you put safe and drugs in the same sentence? Doesn't make any sense. Those two contradict each other deeply. And the policy, you should just look at those two words and it should tell you and give you an answer right there. Safe and drugs don't mix.
The system failed, Brianna. We just needed one adult to stand up in the room to fight for you. You begged doctors and you begged those people that should have been there to do no harm and to help your daughter. What was the message that you got?
That the help wasn't there. The doctors kept sending us away. And it kind of sent a message that really
Didn't matter.
it didn't matter at all. That she didn't matter. And her mental health didn't matter.
I think I read somewhere that you were essentially told if she wanted to kill herself, that's her choice. Is that true?
Yes.
Very true.
Do you believe that Brianna would be alive today if she got the help that she needed, the mental health help?
I believe not only would she be here today, but she'd be able to speak out on her own situation and what she's gone through. I believe if the help was there and available, her beautiful smile would still be here.
And just to be clear, Brianna had just turned 13,
Yeah, just in July 15th.
so she was just a month into her 13th year. July 15th, did you say? It's the same day as my son's birthday. And I should note that she passed away on my daughter's birthday. What does Brianna's story say about the state of mental health care in Canada?
Pretty much that it's broken. The system that is designed to be there to help her and guide her through life, especially when it comes to struggling with mental health, it just isn't there. And whenever we did approach doctors about change and how to get her help, she was either too young for programs or there was no programs at all.
They allowed a 13-year-old to write their own safety release plans, is that correct?
Correct.
She wrote on that plan that she was a very manipulative little girl. And my question is, why was a child allowed to write her own safety release plan when doctors are supposed to be doing that? Because they're the adults. They're the ones deciding on how her safety is supposed to be, not a child that's unwell.
And you were powerless.
Absolutely.
From the time she ended up on the streets to her death, how long was that?
Almost 4 weeks.
It was, sorry?
Almost 4 weeks.
And her drugs of choice were Molly and fentanyl?
Molly, fentanyl, anything she could really get her hands on. Molly was her
Molly was her DOC.
that was her drug of choice, yes.
Are safe injection, safe consumption sites working?
No,
Absolutely not.
no, they don't discriminate against age, and they keep providing kits to these children. And it's very easy access.
It's everywhere. You can't go anywhere without seeing it now. It used to be taboo to see a joint being smoked on the street. Now you can walk by people smoking crack. It's disgusting.
We sat at an A&W once having lunch. This was 12 o'clock in the afternoon, broad daylight. And I had to tell my stepson to literally not look out the window because there was 6 people sitting there cooking their heroin down to be able to inject it right out the window where we're having lunch. That's not acceptable. That's not what I call safe.
Have our communities become less safe in recent years?
Absolutely, and I believe they're getting even more unsafe as the days pass.
Thank you, Mr. Doherty. Thank you, Mr. Charles. Next, Madame Brière, for 6 minutes, s'il vous plaît.
Thank you, Mr. Chair. Mrs. McDonald, Mr. Charles, you have my deepest sympathy, and I share your pain. I salute your courage in sharing this heartbreaking story. What do you think should be done to involve parents in the prevention work in order to protect our Canadian youth?
Our children, we need to be able to stand up for them and advocate for them, not for them to advocate for themselves when they're too young. We are supposed to be their legal guardians. We're supposed to take care of them. We need to do so. We need that authority back.
And as it sits right now, we're just guardians of the government's children. They're not even ours.
Yeah, but did you know where to go to seek for help or to seek for services?
Absolutely, and I exercised every option that I had. I went to hospitals, I went to mental health places, we went everywhere, and we were basically told we have exercised all our options, and we are sorry, and we condole you, and we're happy for your best efforts. Thank you.
And the only gift they gave us really was an Narcan kit, which that's pretty alarming as a parent. Receiving a Narcan kit instead of, hey, here's a doctor's number, maybe these people can help. Social workers didn't have a clue, because and their answer to us was, our resources are so limited. And especially because of her age, there wasn't much they could do.
Yeah. So do you think that the services are more for adult, more targeted for adult than for youth?
I believe when the harm reduction stuff was brought in, that, there was an aspect that children weren't really thought of at that point, because really recreational drugs and stuff like that was more of an adult thing. But now, I hate to say it, it's reaching our children at a very alarming rate, and the children are suffering. And I don't think it's because they choose to do the drugs. I think it's because their mental health is really in the dumps, and it needs to be changed. Mental health needs to be changed, and so do these policies.
Thank you.
Yeah, well, first, I want to thank all of the witnesses for their testimony, especially Ms. McDonald and Mr. Charles, for having the courage to come all the way here and share your story. Hopefully it'll help prevent deaths of young people. It shouldn't be happening. You talked about, if a child broke their leg and they went to the hospital, they wouldn't be denied because we don't have certain types of care for their broken leg. They would get the care. And we don't have parity when it comes to mental and physical health, largely because of the stigma, I believe. Do you believe that we don't have parity because of the stigma in mental health and in physical health?
In my honest opinion, yes. I believe there's a big stigmatism against mental health, especially among youth. I believe that it's been overlooked. And I believe that it's kind of been just put on the back burner compared to, again, the safer supply and the harm reductions. It's almost like it's gotten lost in the wind.
You mentioned that she was held for 10 days and then released. What type of care were you hoping she could receive instead of being discharged? And I guess what type of care do you think would have helped Brianna stabilize and recover?
I think that the doctors actually took the time to like look into her mental health and actually like assessed her properly. They would have seen how many problems she actually had.
You mentioned the lack of availability of mental health programs for youth. This is pretty clear. Do you think the government needs to increase funding for youth mental health supports, and do we need more education for healthcare professionals on youth mental health? Because clearly the professionals demonstrated that they weren't equipped. It sounds like.
I do agree. Yes, there needs to be more education. There needs to be more training for doctors and nurses. I do believe that, there was one time that a doctor actually told us that she's too young to diagnose, which I kind of think is completely wrong, because in the States they are diagnosing children at very young ages and the process is actually working. So there must be some kind of separation between the two, and I believe that lack of education and lack of there should be more funding towards treatments and education for healthcare providers.
Having a child struggling with mental health and substance use issues it's extremely difficult on your family and on you as parents. Did you receive any support while you're dealing with these issues with your daughter? Are there supports that would have helped you and your children as you navigated the broken system when it came to dealing with Brianna?
We did receive a little bit of help, but mostly from a few social workers here and there. They literally exercised all their resources, and they even tried to pull some strings to make things happen outside the box, and they were so tied, like their hands were so tied because everything was so limited. The little treatment centers that we would have had to pay out of pocket wouldn't accept her because she wasn't of a certain age. So yes, we did receive a little bit of help, but again, there was no programs or anything that were actually available for her and her situation.
I'm sorry for your loss, and for Shayton as well, his family.
Thank you.
Mr. Doherty for 5 minutes.
Thank you, Mr. Chair. Mr. Charles, Ms. McDonald, why did Brianna start using drugs, and at what age did she start?
Using drugs at about 10 and a half, shortly after me and her stepfather broke up, and she just wasn't handling it very well.
And she also wanted to drown out the demons and the voices that she kept hearing.
Okay. Is safe supply really safe?
How could you have safe supply and drugs in the same sentence? There's no such thing as safe drugs, period.
Would safe supply have saved Brianna?
No.
Do you feel that Brianna was a victim of failed drug policy?
I feel it isn't just the failed against the drug policy. I feel she's failed by the system, public health system as a whole. There was many different layers of failure. That was just one of them.
Can you tell us a little bit more about Chayton?
He was a loving little boy, very gentleman.
Him and Brianna would sit on the phone for hours, conversating back and forth with each other. They just absolutely adored each other. They were best of friends. They known each other for the last few years and have fed off each other, good and bad.
Yeah.
And he really took it personal, and I really feel sorry for that.
What can the federal government do to make sure tragedies like Brianna and Chayton never happen again?
Make changes to the public health policy. Start giving more funding and providing more educational backgrounds for these health workers that need it. Doctors, there needs to be more training. To be honest with you, it seems like, mental health in children is being overlooked. And these doctors and psychologists and psychiatric care people, there's just not enough that they don't understand. Like I said to Mr. Johns, down in the States, they are diagnosing children with mental health. Why can't we do that here in Canada? What's the difference?
You said that the drugs in our community are getting worse and worse. Are you seeing the diversion of safe supply into our into the hands of our kids and into the neighborhoods that in Abbotsford?
Let's put it in this perspective, Mr. Doherty. When a child can go up and get a bag of items to do safe injection and prepare their drugs and literally walk out that door, there's a drug dealer standing right there. Just like what happened in Nanaimo just recently. They were given the safe harm kits in the front, and out the back door the drugs were flying.
Wow.
So I think that is enough of a statement to prove that, yes, it's becoming alarming.
I've got about a minute left. What else would you want our nation and those in this room to know about Brianna?
That she's a very loving, beautiful, caring girl. She was taken way too soon. She was so compassionate. She had so much potential. She was so smart. She loved to research everything so much. And I wish she was here to share her side of the story right now.
She was robbed of her life, and I feel that she had so much potential to being a powerful individual because she always took other people's problems and she made them her own, and she took it seriously. It didn't matter what it was, how big or small. She was a powerful individual, and I believe with the right education and treatment, and she was able to finish schooling, I'd feel she would be a perfect fit to be in this room with all of us. She was that intelligent.
Thank you for sharing that with us, and thank you for being with us today.
Thank you.
5 minutes.
Thank you, Chair. I would also take this moment to thank Mr. Charles and Mrs. McDonald for your courage to share your story with us and to continue to advocate for your daughter even after she's no longer with us. I think her siblings are probably very, very proud of the two of you and the courage that it takes to do that. I do want to know, you did mention, Mrs. McDonald, a bit about the genesis of her journey in this. What else do you think the federal government could have done to support the province to prevent her starting on this journey before we get to her use of drugs?
I think there need to be more mental health in place for her, as she did talk to people and stuff, but I felt like she was very overlooked by a lot of them, and they weren't actually listening to her in the bigger picture. They were just listening to what was just in front of them, not the whole story.
And do you feel that if there was earlier prevention in her mental health journey, the pathway for her could have been completely different?
I think it would have been completely different. I don't think she would have been drowning out those noises that she had in her head. She wouldn't have been so sad inside and felt so heartbroken and so distraught that she wanted to take her own life.
Do you think that there should be more supports for children like Brianna in schools, everywhere, to be able to, especially if there's some major shift in their lives, like a parent separation? Do you think that these are things that we could implement into our education system from the provincial level?
I do think they could be implicated a little bit more. I know there is some people like counselors and stuff in the schools and stuff, but I do think that it could be more.
And do you think that addressing some of the stigmas that are around families that are going through some shifts could also help the children better navigate their mental well-being while they're witnessing that?
I do think so, yes.
I want to thank you both for being so courageous to answer our questions. I'm going to shift my questions.
As the local MP for our community of Abbotsford, thank you for being here. You mentioned the Cyrus Center. I live just off George Ferguson. This is around the corner of my house. Thank you for sharing your story. If you could send one message to the Minister of Mental Health and Addictions about some of the failed drug policies we have in Canada, what would that be?
That we need more help. The healthcare providers need way more help. There just isn't enough. I get it, there's an opioid crisis going on and there's a lot of people dying from drugs. But the mental health aspect is a big leading factor. And we can't overlook mental health. Drug use and mental health issues go hand in hand. And in order for it to stop, we need more funding.
As you know, the government of British Columbia and Canada signed a special agreement for decriminalization of hard drugs in British Columbia. Is it your experience that it became easier for children to get drugs since decrim began? And how did Brianna generally get her drugs?
I believe it did, actually. The decriminalization of drug use and possession of drugs actually increased the drugs coming to British Columbia. It lowered the prices. It made it easier to acquire because, hey, your mental health medication a lot is experimental and you have to pay out of pocket. It's not always covered. But the drugs can replace that, and people were replacing the mental health pills and prescriptions with the hard drugs. And as per Brianna getting her drugs, she used a lot of it through 16 and 15-year-old kids. And these 16 and 15-year-old kids they actually got really ballsy and showed up at our house one evening. Wow. And I actually had to escort them out of my neighborhood.
I'm just going to ask one more brief question and before I turn it over to MP Goodridge. But as a parent in the public school system in Abbotsford as well, what role does the Abbotsford School District have to play in keeping our kids safe?
I feel there should be more police liaisons. I feel they should be checking the children before they even come to school. If found with drugs on them, they should be punished and realize that it is wrong and they shouldn't be having access to these drugs. Nobody should.
Thank you. Thank you so much for sharing your daughter's story with us and being here. So Justin Trudeau has brought forward the most radical drug policies our country's ever seen. And as you said, flooded the streets with hard drugs, made it so that it was legal for kids and adults to have crack, meth, and even your daughter's drug of choice, Molly or ecstasy. Do you believe that the policy choices that were made by this Prime Minister attributed to your daughter's death?
Yes, I do. To be honest with you, I feel like this experiment, and I'm going to call it an experiment, was directed towards our children. It was directed towards the people that were struggling with mental health. And the fact that she was able to acquire these drugs on a massive level and very easily at her own age, I do believe his policy is what really, led to her death. It's not just his policy, it's the fact that there's lack of funding for the mental health.
So if you could tell him he has the ability with the stroke of a pen to change these policies today, do you think he should?
Absolutely. To be honest with you, we need to protect our children, and he needs to start realizing this. To protect our children, to save the lives of, beautiful, innocent people that deserve this. These are our children. And myself being Status First Nations, it is our job to protect them. And it's his job to help us protect them. Why can't he do that? Put the pen to the paper. Let's get more funding for the people and the children. And let's stop this. And let's do it all together from the top right down to where we are as parents.
Thank you, Mr.
We
Charles.
need more rights.
Lance, Sarah, I was a long-time emergency room doctor. I'm sure in BC there's the same kind of laws as in Ontario, whereby the emergency room doctor has the ability, and I would say has the obligation, if they think that someone presents a harm to themselves, a harm to others, or is unable to look after themselves, they can require a person to stay in the hospital for 72 hours for psychiatric evaluation. How many times did you bring Brianna to the emergency room, and how often did they use that power to keep her and have her observed and at least enter into some sort of treatment?
There's over 20 recorded just in a short time, suicide attempts and self-harm attempts. It got to the point where myself and her father actually pulled a doctor aside and said, don't fall into the narcissistic, manipulative ways of her. She will talk herself out of here. Please take our pleas and keep her here. She needs the psychiatric evaluation. And of course, they kept telling us the same thing. We'll do our best. And shortly after, they kick all of us out of the room, talk to her. Nope, she's fine, and send her on home.
So
Thank
how
you.
many times
Thank
did
you.
they keep her?
That's your time.
Twice.
That's your time.
20 times.
Ms. Goodrich, please, for 5 minutes.
Thank you, Mr. Chair. So just to follow up on the questions from Dr. Pawlowski, so they only kept her 2 times in the 20-plus times you took her into the hospital for suicide attempts. Is that correct? How often, when you're dealing with this kind of situation, I'm assuming that there are many times that you didn't have the opportunity or you chose not to take her to the hospital. How often were you dealing with this, and do you feel like enough was being done to help you?
This was going on daily, and her attempts were almost weekly at the end, if not every other week. They were pretty bad, and we didn't go to the hospital quite often because we knew we would just be sent home and it was a waste of time.
I'm so sorry.
And Dr. Ellis, please, for 5 minutes.
Well, thank you very much, Chair, and Mr. Charles and Ms. McDonald for being here, and I apologize for not being here earlier, but I have read your testimony, and thank you for that. Thank you for telling Brianna's story to Canadians. I just wanted to really focus, if I might, on, now I realize you're not experts in this, but you do have obviously significant lived experience, but if you had to design a system talking about a couple of things, prevention of drug use, and then rehabilitation afterwards, what advice would you leave us here and for all Canadians?
Well, it's not all about time. Time is the key, honestly. The more it's all based on how these children are. Every child is different. Every person is different. There shouldn't be a time specific. If it takes longer, they deserve longer. If if treatment isn't working, there should be a broad spectrum availability of research just to be able to develop treatments for other people. Some do work for some, but not all. It can't be just a blanket. It needs needs to be research, and there needs to be a lot of time put into deciding which paths to move forward. I don't think there's one solid, good answer, but I believe that if time, structure, education, all of these things were followed, there'd be a good program in place, and this stuff wouldn't happen to our children and our people.
Thank you very much, Mr. Charles. When we're talking a bit about prevention, obviously this is the Health Committee, but that falls under perhaps education. Do you believe that there should be programs in schools to educate kids on the harms of drugs and that type of messaging out there, what drugs look like, what they can do to you? Do you have any thoughts on that at all, sir?
I do think that there should be some sort of, because there is for sex ed and stuff, why isn't there for drug education?
I'm with her on this one, but at the same time, you have to be sensitive. These are child's minds. They are undeveloped. They don't deserve to really know these things just yet. Maybe in the teenage years, yes, but it's the same thing with the sex ed programs. They're teaching them younger and younger these days, and this is just now allotting for children to think, hey, look, I can think like an adult. I'm learning about stuff that adults know. It's making them comfortable, too comfortable. So I believe the education should be there, but very sensitive to what the child's mind is, because it is undeveloped.
Thank you very much. That's an excellent point. We have to be cautious with the messages we're giving and at what ages. I think that's very well said. Maybe if we turn our attention a bit to looking at the criminal element in this entire problem. Again, what advice would you give to the Canadian government to say, you know what? Obviously, there's a criminal element here. People are selling drugs. People are making them illegally, etc. Do you have any ideas, perhaps around punishment and jail time, et cetera, efforts that we're making on that front that should be different?
I believe the criminal justice system should actually be a little bit more strict, and actually should really crack down the whip on these drug dealers and people that are selling drugs, and especially to children. I believe that this revolving door that's happening, and this system that's actually failing these, because these criminals are getting locked up for a couple months at tops, and then they're back out, and they just keep doing it back and forth nonstop. They don't care, because they're making money, and that's all it is about money. I believe that stricter policies should shut this revolving door. If they are caught doing it, more than once, there should be an indefinite suspension, that they should be kept there, because these are the people that are killing our children. I feel that, these policies that are in place right now need to be really updated a lot. I feel the justice system needs to stand strong and stand by the people that matter, and that is the parents of these children that are dying.
Thank you, Mr. Charles and Dr. Ellis. Last round of questions for this panel will come from Dr. Pawlowski, please.
So continuing with my earlier line of questioning, you brought Brianna to the emergency room more than 20 times. They only kept her twice of all those times. Now, as I said, the emergency room doctor has the power to keep someone who's got a mental illness and presents a threat to themselves, or is unable to look after themselves. They have the power to keep them involuntarily in the hospital for at least up to 72 hours. I would say they also have the obligation to do that, and the obligation is twofold. The obligation, when people tell me, well, what about my rights? Well, the obligation is from the doctor and for society to intervene with those people is One, to protect people from themselves, because with time, people will often get better, and they may be going through a bad time, as Brianna was, but often, with the chance and with time, they'll get better. So you intervene to protect them from themselves. The other reason you intervene is to protect them, protect the families, like yourself, who suffer the long-term consequences. So I would say the medical profession, the emergency room doctors had an obligation to act and to keep her had they thought she was actively, basically suicidal. Why did they not keep her?
I believe they didn't keep her just because she was that manipulative of a person. She could literally look at you and tell you she's fine, and you would believe her. She was very talented in that department, and the manipulation actually it was so strong that she could tell anybody anything, and they would believe her. There was no. Even when we warned the doctors in the emergency room that, you know, her manipulation skills were absolutely amazing, I don't think they believed us. And honestly, that's what it is I don't think they actually believed what we were telling them. And they thought we were just trying to drop a problem onto their lap. And honestly, I don't think their response was a proper one. And yes, they are obligated to keep her.
Yeah, so I would suggest perhaps you were not very happy with the quality of care you received from the doctors, that you warned them that she was manipulative. Clearly, she'd had repeated attempts, which put her life at risk. And frankly, I would suggest that the care you got in the emergency rooms was not good. Did you complain either to the College of Physicians and Surgeons or to the hospitals, or consider legal suits as a result of her treatment?
It's been in discussion about legal pursuits. It's been in discussion of how to approach the situation, especially with against doctors, especially at CAPSU, Surrey Memorial, especially when, you know, Brianna's sitting there putting a pencil through her hand and the doctors are telling us she's fine to come home, the psychiatrists, you know. And Sarah advocated so deeply to keep her there. She basically cried. And the doctor literally looked at her and told her, no, we're not keeping her.
In society and with the legal system, I think there's this kind of balance between recognizing individual autonomy and individual rights, and what role, if any, does the society, do other people, do families have to intervene? Do you think that we've got, within the healthcare system, within the judicial system, do we have that balance right? Or do you think we've given too much power and autonomy to people with mental health problems and are unwilling to intervene where we ought to be willing to intervene to protect those people?
I honestly think we've given too much power to the individuals that are mentally ill. I believe that we need to start drawing that back and be able to speak out and be an advocate.
And Sarah, you look like you wanted to say something. No?
Thank you, Dr. Pawlowski, and thank you to, a heartfelt thanks to all of our witnesses for being with us here today.